was the worst outbreak of waterborne disease in New Zealand's history, and now a new report has put a price on Havelock North's water contamination crisis. The report, commissioned by the Ministry of Health, goes into some detail about the medical impact of the outbreak and translates all of this into costs. And the sum is large. Eric Frickberg has been reading the report and he joins us now live from Wellington. Hi, Eric. How much did this cost?
Well, it cost an awful lot of money. It was $21 million in total. And who paid that money? It was people like you and me, John, if we'd been living there. And there would have been a lot of us. There were 5,088 households in which someone at least got sick in their household. And it cost a lot of money, $2,440 per household. Multiply that out and you get $12.4 million for the household sector. Now that's an awful lot of money, and it's way ahead of the next sector to pay the next largest amount, local government, $4.1 million, and doctors and hospitals, $2.5 million. Now all that's a lot of money, and it adds up, as I said before, to a total cost of this crisis, $21 million.
Right. You talked about the impact of households in this community. How does all of this compare with the $200,000 offered by the Hastings District Council and the Hawke's Bay Regional Council for people who had suffered seriously from the disease? Given the figures that you've given us, that sounds woefully inadequate.
Pretty much so, $200,000 as you say. Now since then 37 people have applied. They had to have been sick for more than 6 months, and they were. They haven't yet heard whether they got the money, but it doesn't come close to the real costs. Now what happened was people got sick. They couldn't go to work, they couldn't drive their kids to school. They had to, if some of them were okay, they had to drive to get fresh supplies, fresh water. They had to spend a lot of time cleaning the house, doing more laundry, and that costs money. But there's more to it. Many people who got Campylobacter got more sick as a result. 3 died, 3 got Guillain-Barré syndrome, which is very serious. Others got something called reactive arthritis. Many already elderly people progressed faster towards frail infirmity than would have been the case otherwise. And if that's not enough, John, there are these: hypertension, lower leg cellulitis, urine retention, delirium, and pneumonia. Now, John, all this, as you can imagine, has a huge personal cost. But what the authors of this report have done is to look at it economically. They've worked out how much is this worth. They've done that through something called the opportunity cost, which is the value of the next best thing they could have been doing. Now this sounds like cold-blooded analysis, and it probably has a place, but it doesn't come close to addressing the real price that people paid for this disaster.
Eric Frickberg joining us live from Wellington. Thank you so much, Eric.